I know that you are very, very talented when it comes to this topic of male sexual health. I really would love to get your medical opinion of that and what you're doing to help men and their sexual health.
Everybody's got some testosterone, estrogen, but when you have excess amounts of that, then it kind of affects everything else. So you don't want to have too much of that in your system, essentially. When it comes to, just people with ED, which is part of this space too as well. For some time now, there's been treatment with platelet-rich plasma, PRP, which can help with the vasculature within the penis to help with that so that people can have better erections. That's typically combined with the shockwave treatment, which also stimulates healing too as well and same flow to the area. So when you combine that along with just looking at some of the more underlying issues, people will have better results overall versus just taking a hormone replacement therapy and not doing anything else. So again, it's kind of taking more of that deeper dive and trying to get people better. When you put all that together, people generally tend to do much better in the long run. So that's kind of more of what we tend to do.
I know shockwave has been, it's a scary sounding therapy, but it's been around a long, long time. And I've heard very good things about that. So you're a fan of shockwave therapy?
Yeah, so we use it for pain and use it for sexual health too as well. So it's something that doesn't really cause any significant pain whatsoever. The name doesn't sound the best in the world, but it doesn't cause any significant pain. And actually, when you utilize it too as well, even if on a painful area, within like a minute or two, you start noticing that stops hurting. So it feels better. So it's already stimulating some healing, even though it does take time. So shockwave for pain does take time, just like any regenerative treatment. But even with flow to the penis too as well, it does take time. And most people tolerate it really well. So it's not like it's something that's folks have to be really scared about or whatnot. So a lot of times they'll even just, put the machine on somebody's arm to let them know how does it feel. And they're like, oh, okay, it's not so bad. It's really not that painful. Quite honestly, it's not painful at all. I've had it like a bunch of times too as well, even on like tender points and things like that. So it's not significantly painful. So it's definitely something that's been used more in the regenerative realm too as well over the last few years, and there's been more of a push to utilize it.